Well, welcome everyone. For those who can watch from afar and those that are here, welcome. Tonight we're going to be talking about cannabis and migraine, and I have some slides. It's really cannabis and headache because migraine is just a subset, and cannabis works with all of the different various headaches. So might as well bring it home to everybody on the basics. The roster, the table of contents for tonight is pretty wide. I'm trying to keep everything very basic because there's a lot we don't know and a lot we're still learning. But today we'll cover the overview of kind of what headaches are, what kinds of headaches they are, what they mean, how people can treat them, what the sort of standard of care is these days outside of cannabis, and then look at cannabis treatment of headaches in history, clinical reports of cannabis use, and then I'm going to run through how cannabis actually works for headache. This is not mysterious. We have lots of reason to think that what we know in anecdote bears out in regular physiology and our understanding in bench science. And then what seed clinics seeing today on the ground, real people getting relief, and of course how to learn more. The punchline on how to learn more is right here. The bit.ly/seed headache is a drive that I put together, a folder of 70 odd papers that just describe the evidence for cannabis and headache. It's quite substantial. I sort of cherry picked the things that I think were most interesting to people, most related to headache and cannabis. It's a little bit science heavy, so I think people would need translation to read it, or at least get material out of the pictures. But I'm always happy to translate if people want. And then more basic information, as you can see. All right, so we'll get running. If anybody has questions, please feel free to either put them in the chat down below or the Q&A. Both of those are fine, and I'll try to get to questions as I'm going through the slides. All right, so a headache, as we think of it, runs the gamut. In the clinic, if I'm asking people what kinds of headaches they have or how they describe them, there's no formula. Someone says, "Oh, I have a type A135 headache." We all describe what we're feeling. It hurts here, it hurts over here, it hurts when I'm, doing this, or it hurts after I do that, or I feel this before I have a headache. We all kind of live in this world of interpretation and our own body signals. And that world of chaos is what doctors take to make diagnoses. I mean, we organize it and we create patterns of statistics that tell us when someone complains of a headache, which is like this, oh, look, it gets better with those treatments. And we kind of create these maps of treatment, formulas, protocols of treatment that are mostly geared around either the concerns, the sort of the manifestation of the headache, how it appears in the body, how it's felt by a patient, or what the mechanisms of the headache are, what is causing the headache, kind of on a microscopic scale. What are the cells doing? What are the nerves doing? And then how do we use our understanding of those nerves and of those cells to quiet that headache down? So there are two different kind of approaches. One is very naturalistic. Hey, shaman in the 18th century, I have a headache. Can you do a dance for me? That was the sort of protocol back then. That's evolved over time to I have a certain set of symptoms and it gets better with Tylenol, or it doesn't get better with anything, or it gets better when I'm in the dark. And doctors take that information and then create a treatment path for it. Visually, I stole this from the web. It's basically an example of all kinds of headaches. Really, there's as many headaches as there are people. For some people, their headache is focused only on the jaw, or only one side of the jaw. For some people, it's straight down the midline, only their left side hurts, or only their right side hurts. For some people, it's only one part of their face. It might not even be a whole half of the face. It might just be the upper half. And to some extent, these help a doctor understand what might be causing the headache. If the headache is in the jaw area, you might ask a patient as a doctor, oh, did you have something to eat? Is there something about your teeth that hurts? And you might understand that their headache might be coming from a jaw-related thing. Alternatively, if someone's complaining of just their forehead hurting or just their sinuses, and you ask about sinus and allergy kinds of questions, and it's not related to that, that happens to be the distribution of a cranial nerve called the trigeminal nerve. And the distribution of the headache and where those nerves are coming might give us a clue to what might treat it. In general, the sort of tapered down list is here. Also, took this from Google Images. Migraine tends to be, a localized headache. It tends to be lasting, anywhere from short time to a very long time. It usually is pulsating. Usually comes with an aura, something where a sensation, a smell, a sight, a sound that the patient knows the headache is coming. And all of the other types are just different types associated with different origins. Some of them are more muscular related. Some of them might be more congestion or pressure related. But I'm going to go through kind of the cannabis piece of this. And part of the reason I'm going into such detail with these is to highlight what I will show later in terms of where cannabis applies. Now I'm going to get into the only really science-heavy portion of this talk. It's very easy to talk in broad sweeping terms, and there are people in the audience who really appreciate a much more detailed perspective, which I want to give here. Basically, I'm going to be talking about at a microscopic level what we understand are causing headaches. The truth is, science is learning, tremendously in the last couple hundred years. Before the last 200 odd years, we really didn't have even a basic understanding of what was happening with things. There was a time in medicine where you thought it was bad spirits, or you needed to drill a hole in someone's body to evacuate evil spirits. So the detail that we're at now, and the ability to understand things is still pretty vague. We understand that signaling is happening at some level, but not with enough detail. But here I do want to get at least to share the detail that we do understand. Okay, so within glutamate signaling, I'll cover each of these sort of separately. Within glutamate signaling, basically, one of the telltale signs of a migraine is this aura, this kind of premonition of something coming that I was talking about before. When we look through a scientific lens, what we see is a wave of electrophysiological hyperactivity. Electricity is basically going wild in the brain. That's followed by a period of suppressed inhibition of those signals. That inhibition, that sort of depressing of signals, is called a cortical spreading depression, a CSD. And that's considered what's happening on a neurobiological level associated with an aura. That has been associated, that CSD, that global kind of inhibition, has been associated with extra glutamate signaling going around. So we don't necessarily know why, but from an electric kind of lens, we see there's suppression of electrical signals. And then we happen to do blood testing and sort of local tissue testing at the same time, and we see, oh, interesting, there's a lot of glutamate signaling going on there. So obviously those seem related, because in the cases where there is that, you get a migraine. In cases where there's not a migraine, you don't see that. So it seems like a pattern to say, okay, that's meaningful. One of the interesting things about endocannabinoids, these are the cannabinoids that we're all born with, is that they suppress glutamate signaling. And that's done through certain kind of receptors called NMDA receptors. So we know that cannabis happens to suppress glutamate signaling. And we think that there's this clear association between glutamate signaling and migraine. So they seem related. And I think that's probably as deep as I should go. but perhaps also to say just that THC as a CB1 receptor agonist, THC happens to touch this receptor called CB1. That happens to suppress CSD in mouse models. So we haven't really kind of figured this out in humans, but in a model of an animal that's, at least a biological being that can experience headaches, THC does show effects. The truth is, in clinic, as probably anybody watching would already know, THC is wildly effective for people with migraines. It's one of the best effects I've ever seen clinically. But in terms of the science that's printed and published and sort of peer reviewed, it's still a long way off. All right, maybe I'm spending too much time on each of these categories, but glutamate signaling, done. Trigeminal activation. One of the things that happens, one of the most reliable triggers for migraine is nitric oxide. This is in all of our blood vessels. It triggers changes in the blood vessel shape. When people talk about migraine, sometimes you might have heard it's about the blood vessel changing shape. It's getting dilated or constricted. It so happens that endocannabinoids inhibit nitric oxide. The cannabinoid we have in our bodies, anandamide, has been shown to inhibit vascular dilation. So actually, endocannabinoids in our body are basically shown to help constrict blood vessels. Interestingly, for those who might be attentive watching, cannabis is also known as a vasodilator. It happens to increase the diameter of blood vessels. And that's through receptors that we know about. So just leave it at that. So this creates an interesting puzzle. If I've just said that some endocannabinoids make blood vessels smaller, and I've also said that, well, cannabinoids also make blood vessels bigger, that creates a real puzzle. Well, how does it affect migraines? And the interesting thing is it's probably through a dose-related effect. At lower dose, you probably have constriction, and at higher doses, you probably have dilation. And we come to that conclusion based on how we know some cannabinoids bind to different receptors. So cannabinoids bind to one receptor very readily, that's going to cause constriction. And when there's enough extra cannabinoids floating around, we're going to start seeing the other receptors being activated that might dilate. The reason I sort of hammer this home is because one of the things that we realize about cannabis as we're learning more is that dose matters, that you have kind of different effects, and also to help explain how some people respond one way and other people respond very differently, because we all have different normal tone of blood vessel dilation. All right. We also have different concentrations of the different receptors which react, to this constriction and dilation with cannabinoids too. So hopefully that's sufficient there for explanation. The third item here is platelet stabilization. This is an interesting one that probably most people have not heard about, but it's mostly associative. One of the things that we use to treat migraines with are serotonin treating medicines, antidepressant medicines as we often know them by. One of the things that we have figured out as we look at platelets, when platelets are collecting, when a clot is forming, there is serotonin released. In people who have taken serotonin kind of blockers or inhibitors, have found that it helps their migraine. So we have an association here that makes sense, and we're trying to figure out what that is. To throw cannabis into the mix, endocannabinoid levels are reduced in the platelets of migraine patients. And interestingly, women with migraine tend to show increased levels of the enzyme that degrades cannabinoids, FAAH. And they also have increased activity of a transporter of endocannabinoids as well. Suffice it to say, women tend to have migraines more often, and also women with migraines tend to have some levels that are different in terms of their endocannabinoids. So there's another association there. We don't have enough detail to explain that, but it seems like it's a consistent trend. Okay, and then lastly, modulation of pain signals. basically, if blood vessels are changing shape, there's more blood flowing through a dilated vessel, or maybe more quickly through a constricted vessel, there are changes in pressure. And those changes in pressure, just like if you were touching your hand and you feel pressure, there's a signal happening there. Some little machine is saying, "Yep, you're pushing your finger onto my hand," and that signal is transferred, down the wiring of my nerves into my spine, and then back into my brain for processing. Anytime there is nerve signaling, there is also endocannabinoid feedback. It's just a natural part of all of the nerve systems in our body. And cannabinoids can impact the sort of volume of that signal, both locally and at the spine, where it's reaching, your brainstem, up here in your brain, and then also in the rest of your brain. So this is sort of the signaling of the electrical signaling version of all of these four. Okay, I'm done with the sort of fancy medicalese, and now we'll get into the rest. So what do people do for migraines now? Over the counter, there are plenty of options. People mostly in the culture know you can take Tylenol, you can take Motrin, you can take Advil or acetaminophen. There are some other options people use. I've not seen Benadryl used that much, or Dramamine, but I guess in children we do. I took this just as a fun, pretty picture. But then on the prescription side, as migraines become very severe, we open up the pharmaceutical options, which tend to be stronger. They tend to be more precise. They tend to be more effective, for strong, severe kind of migraines. Those options are many. Some of them are pills, some of them are injections. People have done Botox for migraines. There's a whole host of choices we have, as I was mentioning, serotonin, and other medicines like the antidepressant sort of world, that act on different receptors to try to attack something that will work. It's really, although it seems precise because we're giving a prescription for a migraine, it's a little bit of throwing a dart at the board, hoping it sticks, because it's hard to know inside someone's brain what their particular physiology is and what might be going wrong in that case to cause them a migraine. And I'll come back to that sort of non-specific treatment in a minute. So on the doctor side of things, there is this protocol. If someone has a diagnosis of migraine, of course we're educating that patient about what they can do, kind of outside of the doctor and prescription kind of mode. We're assessing how complicated it is. We're trying to understand where the action is, where the problem is, and then we have a sort of set protocol of how we treat migraines. And obviously this is pretty clear here. One of the things that's obviously missing is cannabis, and we'll come to that in a sec. One of the things that I want to point out on this slide is, if you look closely, how do you at home with a migraine deal with that migraine? Oh, we're going to tell you to watch the things that might trigger it. For some people, it's smelling certain things or seeing certain things or bright lights. We're going to tell you to sleep, have good sleep habits. We might talk to you about exercise or weight, relaxation, so stress kinds of things. And the reason I'm bringing up stress and weight and smell or triggers like exercise is those are pretty unique domains of your life as a human that seem to be contributing to migraine. And I'll cut to the chase. If we think about how people use cannabis, they use it to help themselves sleep. They use it to help, deal with stress. They use it to help exercise, or deal with eating if they have appetite concerns. They certainly use it for pain and anxiety. So the picture I'm trying to paint is in the regular medical office now, we have this protocol which is addressing all of these things on the one hand. On the other hand, we have this medicine which seems to be treating all of these things for different people in different circumstances. And obviously the parallel I'm drawing is one of the underlying threads for headache treatment and for headache manifestation is the endocannabinoid system. All right. This was just a funny slide for Medicare and what kind of options there are to cover migraines. And in sort of sad irony, in particular, they put in the purple side in the middle that medical cannabis is not covered. And I think this is going to be one of the cultural shames that we look back on, thinking how silly this was. But right now it's so relevant, and I'm fortunate. I'm happy that it is relevant, that people are thinking about it in the culture, but for the wrong reasons here, that it's not covered. I'll pause here and see if there are any questions. I can. Yes. Okay. Any questions here yet? Okay, good. Then I'll keep going, or I put everybody to sleep. Okay. So historical reports of cannabis use, suffice it to say, cannabis has been part of the human experience and experiment forever. This is pointing out a couple 19th and early 20th century cases where people, in advisory positions, doctors, clinicians, scientists, were using cannabis. And it's highlighting that basically it was all kinds of different cannabis. It's really been, simply put it, just an inextricable part of the human experience, both preventing headaches as well as aborting from them once they're there. Okay, and then this is looking at clinical reports. Just the idea of evidence. We in the medical community, in the scientific community, look to evidence to really guide our treatment. To some degree, we listen to patients and kind of hear patients and learn from them. But for whatever reason, that's not a mainstay of, for many reasons, that's not a mainstay of medical practice, because we would be persuaded by the people we happen to see. And what we look to for more reliable guidance is an evidence, sort of in pristine circumstances, under ideal conditions, that are focused on learning about a certain question. How is cannabis affecting people? And this is just a bunch of case reports and case series where we're looking at individuals who've had migraines and are responding to cannabinoids. So the idea here, the punchline is that there is evidence growing. It's still pretty thin. A lot of it is very old, but the sort of process of science is certainly motivating and moving along. Snail's pace, nonetheless. And then this is evidence that shows basically supporting what I was describing about those four kind of areas of effect for cannabis and migraines. But showing how headache is developing and how cannabis is involved. I was talking about CNR1 gene. This is the variant where some people who, like women who are prone to migraines, tend to have variants in that gene. So we're starting to see why we can explain, these women who tend to have more migraines than men. There are also different cells in our brains that are reliably related to the effects of cannabis or the effects of the migraines. Within vasculature, the blood vessels, we know how nitric oxide affects the constriction and dilation of blood vessels. We've seen how anandamide affects that. As I was saying before, we've seen in mouse models how THC can affect that, but we're starting to kind of piece the puzzle pieces together. And I suppose this brainstem, this is sort of the nerve signaling I was talking about, and how cannabis is involved, and the platelets is there as well. So more or less everything I was trying to explain before, but here's the evidence where it comes from. This is a theory, as I'm sort of alluding to, of endocannabinoid deficiency as a cause, or at least an explainer for why headaches happen. I've talked about most of these things. At the top and middle here, the CSD, the cortical spreading depression, that's the electrical signaling that's kind of down. We were also talking about the trigeminal vascular response. That's the blood vessels kind of responding and sending a signal, which cannabinoids can affect. There are a bunch of others. 5-HT, that's the serotonin we were talking about. We've talked about all of these, but this is basically just a pretty organization of how different systems happen to respond to cannabis. Now we're moving into the seed clinic and kind of feedback that we get. And this is a question about, you know, what concerns have brought people to the clinic. And as I've shown with the arrow clue, headache and migraines are a pretty common reason that people seek care. And as you'll see later, you know, a pretty common source of relief too. In terms of how much these problems are affecting people's day-to-day life, as you can see, it's really powerful. You know, there are people now, especially with long COVID, that have daily headaches, and it's just, you know, it's a risk factor for suicide, because imagine suffering, you know, any injury for a prolonged period of time, but a headache where you can't live in your own skin, it's quite awful. And this also highlights the magnitude of effect that cannabis could have to be able to save people from some pretty terrible suffering. This is a question I like asking patients, which is, how has medicine failed you? I mean, what's regular medicine doing wrong? You know, and the list of things here, you know, the side effects, the anxiety associated with it, taking pain pills over and over, you know, not getting any relief, taking too much time out of your day, drugs are worse. You know, the idea that they prefer something natural, or they want something holistic that's not just a laser beam at one particular problem. They don't want to be on opioids. There are all kinds of things that medicine has really failed, that I think, you know, not that necessarily cannabinoids are going to be perfect, but they sure are a splash of spring water. For people that are using cannabis, how often are they using it? You know, so within the headache domain, how often are they using headaches? Is it as needed, or is it pretty regular? And you know, more than half of the people use the cannabis regularly. Some people just use it as they need it, but the really awesome thing is, you know, the power is really in the hands of the consumer. That this is not a prescription, it's not a doctor dictating what you should do. It's you gazing at your life, learning what your needs are for that particular day, and making choices accordingly, which I think is a nice change for the medical industry. How are people using cannabis? You know, this is a common question for people that are very new to cannabis. Is it all about smoking? And actually here, you know, a lot of people do choose to smoke cannabis. A lot of these people tend to be older, or at least, you know, that was the way that they understood cannabis all along and enjoyed it. But plenty more people are doing things which are not smoking. If you total up the folks who are not smoking, it's far greater than the people who are. And this list is going to get longer as the industry matures. We'll find more methods of delivery. Just, you know, this year we've seen seltzers take over Massachusetts. They're flying off the shelves. This is a can of seltzer water that's medicated with a low dose, and it works quickly. People really love that. What time? When are people using cannabis? You know, a lot of people using it very often. Some people just in the weekdays. You know, it's kind of spread across the board. Basically, this is, again, consumers' preference, but there's no one right way of doing things. Same kind of idea. You know, a lot of people are using regularly because they're getting relief. There are some people who just use it once in a while, sporadically, but you know, for the bulk of people, they're getting great relief and using it pretty often. For people who happen to be inhaling, whether it's smoking or vaping, you can see here what their kind of choices are. It's basically across the board, but a lot of people are using, you know, 3 or 4 puffs. This is not people toking it down, you know, smoking like a chimney. You know, everybody's kind of different individually, but it's all within pretty limited volume. I think a stark difference for most people who imagine, you know, people who are consuming cannabis are just, you know, smoking down like puffer fish. In terms of edibles, you know, most people out there are choosing lower doses. You know, I happen to see some patients who are very experienced with cannabis and have high tolerance, and they end up taking quite larger doses. But the bulk of people are really taking very small doses. This is not people, you know, kind of trying to knock themselves out. They're just adding a little bit of mood hack or a little bit of relief for a migraine, I guess, in this case. All right, next slide. This one got cut off a little bit, but the juicy part here is how much is cannabis saved. So one of the things that's important to consider is pharmaceuticals cost money. Over-the-counter options cost money. This is showing that when people are asked how much cannabis has saved them, for some people, not very much. The cannabis is expensive. Maybe they're not using it that often. But you can see here that between 35 and 26 and 21 and 14, that's massive amounts of their total costs. One of the things that I ask, maybe it's on the next slide actually. Yeah, does cannabis help save you from other medicines? And green is yes. So one of the interesting things is we see as people embrace cannabis, as they trial it out and see kind of what's fitting for them, almost all of them are able to get off of other medicines that they were using. Their illnesses are not going away. This is just using cannabis to replace them, the treatments. How has cannabis helped on a general kind of view? For a lot of people, it helps improve quality of life. It's very general. For some people, it's physical symptoms. For other people, it's about psychological kind of sadness and mood and stress. But across the board, people are really enthused. Specifically, just for fun, it's not really on topic, but during the pandemic, how has cannabis helped? People are feeling like they're having better sleep. They're less anxious. They're adding a little bit more joy, a little bit less pain. Things that are all quite welcome, in these tough times. We talked about this a little bit. Cannabis is saving people from other meds, but interestingly, and notably, perhaps from a political lens, cannabis is helping people use less alcohol or less tobacco. People are using less antidepressants. They're using other addictive substances less, including opiates and benzodiazepines. This is from a zoomed out view, a public health win. If we can save people from the damage that alcohol and tobacco and some of these other addictive medicines is causing, we're doing something right. Okay, this is the last slide here. Basically, resources if you want to learn more. As I alluded to before, the bit.ly link is a list of the papers that I think are useful and interesting about cannabis and headache. These are other channels where I'm trying to educate the public. Everything is free. If you have any interest, I'm also on Clubhouse from time to time and love to take questions and answer sort of sessions there. But I hope this has been helpful. And I guess we'll check if there's any questions now. Here we have one. Hi, are there any studies being done in the US right now? Yes, there are many. At Seed Clinic, I'm sort of doing an active survey of how people are doing, and that material in sort of bit by bit is going into a study, and I intend to publish it. If the question is about active studies where you as a migraine sufferer could sign up and be able to try cannabis treatments, that doesn't exist yet. Part of the problem is, cannabis is federally scheduled illegal, and that limits the surveying bodies that can approve such a study. There are still approved studies that are done under very strict circumstances, but they, as far as I know, are not looking at migraines. But there's a laundry list. I mean, thousands, if not hundreds of thousands of conditions now that we have to re-examine because we all of a sudden realize that cannabis is a fundamental part of what it means to be human. Does that get at your question? Are there any other nuances or other questions you have? Okay, great. Well, hopefully this has been helpful. If you have questions, please feel free to reach out. Look forward to more discussions. It's always fun for me to learn and review too. All right, have a good night, everybody.